So for our next session, which is on sports medicine, we're really excited to bring together two specialties of medicine that often work in synergy to help patients recover. So we're really excited to have Dr. Cindy Lin, who is a UW Clinical Associate Professor in Sports and Spine Medicine in the Department of Rehabilitation Medicine, and Dr. Lin is an American College of Sports Medicine, Exercise and Medicine emerging leader, as well as a member of the ASCM EIM Clinical Practice Committee. Dr. Lin has been involved in national and international sporting event medical coverage and has published many journal articles and book chapters. Her research interests around clinical innovations focus on exercise promotion, sports injury prevention, and women's and youth sports medicine. So we also have Dr. Titonath Dith. Dr. Dith is a doctor of physical therapy and director at Atlas Physical Therapy, and his expertise is sports medicine, outpatient rehabilitation, and home health care. He has received awards for providing care and being the Physical Therapist of the Year for home care in Washington State. And Dr. Bryan Simpson is a doctor of physical therapy and clinical director at RET Physical Therapy. He specializes in sports injuries and rehabilitation, and he also specializes in the care of long COVID patients. So thank you so much, Dr. Lin, Dr. Dith, and Dr. Simpson for joining us today.
Thanks so much for having us.
Thank you so much. So the first question we have is for Dr. Lin. Dr. Lin, you have pioneered work on exercise and medicine. So can you please talk about this program, especially in the context of young people, their wellness, and the prevention of sports injuries?
Sure. So this concept, exercise in medicine, was started by the American College of Sports Medicine, which is a national organization of sports medicine professionals in the US. And it's the idea that physical activity is missing from healthcare. So oftentimes, we talk to our doctors, especially as you get older, you start, common chronic medical conditions, high blood pressure, diabetes, heart problems, and rarely is physical activity and movement a part of that conversation, because there's really no easy way to prescribe it in healthcare in the current setting, outside of obviously physical therapy, which is oftentimes very injury or injury prevention specific. And so the exercise medicine initiative is focused on getting every outpatient physician to talk about exercise as part of routine medical care. And I've worked on some technologies with UW Computer Science to help make that easier as well. To your first question about, how about young people and wellness? So being physically active, I know it's really hard during the college, high school, busy grad school years, but it's just so important for your health, not just physical health, but also for stress reduction, mental health. I know that as we're in school, we sit a lot, right? Because it's either screen time or studying. And there's been studies showing that if you sit for more than 6 hours a day on average, it is linked with a higher risk of early death or, sort of heart complications later on. And so it's really important to try to break up prolonged sitting time. I hope everybody who's off video has time to walk around and take some steps, while they're on this conference as well. But that's just so important to not sit for prolonged periods of time, because there's a lot of research showing that that's not good for our health either.
Thank you so much, Dr. Lin, for that. The next question we have is for Dr. Dith. So Dr. Dith, can you please talk about the role of physical therapy in sports injuries, and why is appropriate therapy and at the right time so important? And also, what are some of the common injuries you see in your practice? I just saw Dr. Dith here.
Yeah.
Okay.
Good morning, everyone. Thank you for having me here. The different type of sports injuries we see could be from ankle sprains, knee sprains, rotator cuff syndrome, and then you have more invasive ACL repair. We like to see them as early as possible, but after surgery, it depends on the protocol by the physician. The simple ankle sprains and knee sprains, usually if things don't get better with rest, ice, compression, elevation, then we'd like to see them at least 2 weeks if the symptoms do not change. Let's see the other questions that you had. Oh, let's see, the host has asked this time. Okay. Sorry, I'm having a little, there we go. There's the video. Okay. So the role of physical therapy, we work on decreasing the swelling, decreasing the pain, improve range of motion, improve strength, and all to improve the functional outcome and allowing the person to return to sports safely.
Thank you, Dr. Dith. So the next question is for Dr. Simpson. So Dr. Simpson, I would like to talk about ergonomics in this digital age where everything, including education and business, is on the computer. So how important are ergonomics and what injuries would they prevent?
You should be able to talk.
Are you able to unmute Dr. Simpson?
Oh,
there
hey,
it is.
there we go. Hey, sorry about that. So ergonomics. So yeah, it's, especially in the last year, this is something we've all been dealing with, especially all you students. Early on in the pandemic, we saw a couple people even virtually through physical therapy. Now, PT is not really one of those things that's better through a computer screen. There's a lot of hands-on stuff that you need to do. But even I've been exposed to it to a certain degree. And I've certainly been a student, and as Dr. Lin was talking about, getting up and moving is really important. And that they hammered that pretty strong early on in school. So I think it's kind of similar to being like, there's some similarities to almost like being a factory worker, right? And I've told this to new moms too. If anything, you're going to do a lot. You need to be prepared for it essentially, and you need to be able to manage it. So if you're just here all the time, like leaning forward on a screen all day, frequently the injuries that or the pains essentially that can be associated with that, neck pain, low back pain, shoulder pain. Some people, if you're arthritic in your knee and you get up and then you're stiff from having sat for more than an hour, all kinds of things that you can think of. So essentially, you want to set yourself up for success so that you can do what you need to well. And like Dr. Lin mentioned, getting up and moving and not being in the same position for 6, 8, 10, 12 hours a day makes a huge difference. And I think you guys have heard already, there's a wealth of research showing all the different benefits of exercise, including mental health, ability to focus, and ergonomics is certainly a part of that. So I don't know if you had other specific questions, Mayor, about each different ergonomic scenario, but there are many and they play a huge role.
Thanks, Dr. Simpson. So the next question is for Dr. Lin. So Dr. Lin, can you please talk about some of the latest innovations that have revolutionized sports medicine?
Sure. So I'm a non-operative sports medicine physician, so I don't do surgeries, but I see, people who won't need surgeries for sports medicine care. And I have to say that in, the past decade, the increased use of musculoskeletal ultrasound has really expanded our ability to diagnose conditions. And so that includes when I go to event coverage for sporting events, sometimes we'll have an ultrasound. They even have ones that are small, portable on a tablet or on a phone where you can use them and make a diagnosis. Maybe before we would suspect a tear of the Achilles and tendon, and now we can actually see exactly how torn it is. So it's been called sort of like a stethoscope, right? So the ultrasound is now sports medicine stethoscope, where we can actually really see and visualize what's happening in terms of muscle tendon injuries. And that's been one of the areas. I would say the other area is just the expansion of digital health, wearables, and trackers. That's really helped us to get a better characterization of how active our patients are, whether it's using Fitbits or even smartphone-based apps. And they can track all sorts of activities, and some of our collegiate athletes too use it to track their sleep cycles. And there's even some apps that can help predict sort of like onset of illnesses just based on changes in their patterns.
Thank you, Dr. Lin. So, Dr. Dith, I know that there's so many young people out there and probably here in this conference too that play sports. So, Dr. Dith, since knee and ankle injuries are so common in young people, what do most people do after injury that you would actually advise against? So, what are some of the things that people should, what are some common things that people should avoid doing?
I think that after recovering from an ankle or knee injury, they should be cautious in going into real active sports until their balance, proprioception, and strength is better. It has to be a gradual step-by-step process to avoid injury, making sure that they're stretching routinely and doing the necessary strengthening exercises.
Thanks, Dr. Dith. So, Dr. Simpson, you are seeing a lot of long COVID patients. Can you please tell us a little about them? What challenges do they have, and how are you treating them?
So everybody kind of experiences long COVID in a different way. And so things that I'm asking about is, were you hospitalized? What was it like? Did you spend any time on a ventilator? That kind of thing. And most of the folks that I've seen, they are not in that boat. But the biggest challenge is that it's a really humbling experience to deal with that. So you have where you were before, you get COVID, and then you recover from it, or at least it seems so, and then you go back to your everyday activities. And then before you know it, like you're at the grocery store, and sometimes just the sensory overload on top of with the physical activity of walking through the store, putting things in your cart, that's enough to, like, you need a nap essentially for like 2 days. It takes a long time to recover because you've just totally overloaded your system. And so I think the hardest part about coming back from long COVID is the patience that it takes to slowly progress, limit your stimuli, and just generally be aware of the things that are going to make you essentially like have a setback. And again, it's really frustrating for patients, and for someone who's like, so for instance, if you're a single mom, you have to take care of your kid, right? You have to work at the same time, and then all of a sudden you can barely make dinner, right? That's pretty startling for people. So it can be pretty challenging in that regard. So yeah, it's really just gradual progression. And as far as what physical therapy does, a lot of it early on is just education about that, and that goes a really long way. And then from there, you start working on whatever the impairments are. So if they're too weak to go up the stairs, you start working on their quad strength. If their balance is poor, or their inner ear, their vestibular system has been affected by that. Sometimes you have to work with that too. Some folks will get like a brain fog as well, and we'll refer folks to occupational therapy. That's not really my discipline per se, but usually it's just gradual, low intensity exercise, and then you kind of slowly expose yourself further to more stimuli and more activity.
Thank you, Dr. Simpson. So, Dr. Lin, with contact sports like football, what kinds of things should people, especially young people, be aware of and watch out for?
Yeah, so with contact sports, it's important to wear appropriate protective equipment. So if helmets are advised for that sport, it's important to wear that, and other protective gear on the body can sometimes reduce the risk of more just like bruising or sometimes rib fractures. I think another area that's important is that we focus a lot on visible injuries, and sometimes in contact sports, you can get an invisible injury like a concussion, where you may not see like a scrape or a bruise on your arm or leg, but if a concussion could mean that you get knocked out during sport, or there's a collision, or just like a sudden force or whiplash to the head. And sometimes the symptoms can vary really widely. It could be from just feeling a little dizzy or foggy afterwards, not being able to concentrate at school. And it's important to take appropriate brain rest and physical rest after that, and to seek medical attention too, right? So it doesn't always mean that you have to black out or lose consciousness to get a concussion. I even remember, like when I was in college 20 some years ago, I had a concussion because I was competing on the equestrian team and I fell off my horse. Back then they didn't even tell us to stop or take time from school. I had finals that week and I still did it, and I felt so sick and I felt terrible. So it's really changed so much in over these years, and that now I think most providers are educated enough to tell people that, hey, if you just really had a bad concussion, like you need to take time off from school and rest your brain so you can recover fully.
Thanks, Dr. Lin. So, Dr. Dith, I know that you also do a lot of manual manipulation. Is that a central part of physical therapy as well?
Yeah, so all the joints, you want optimal movement and increasing the range of motion. And there's spinal mobilization, and then there's the manipulation of peripheral joints. And what we're looking to do is getting that full range of motion on a gradual basis, and allowing the muscles to reset, getting them to relax, decrease the tension, and allow them to fire optimally for strengthening.
Thanks, Dr. Dith. So, Dr. Simpson, how much and what kind of exercise would you recommend for people in their teens and 20s?
So I don't know if you've tried to convince a teenager to do anything, but it's not easy. So again, there's a whole bunch of research, and I think Dr. Lin alluded to it a little bit. If you were to just look at the outcomes of exercise and compare it to like a medication, and you didn't realize it was a medication, or that it was exercise instead of a medication, it's might be like the best drug that we have as far as what it can do and what it can prevent. Generally, the research is associated with cardio, so like getting your heart rate up, and typically that's 30 minutes, 5 to 6 times a week. Now again, it's hard to convince people that don't want to exercise to exercise. If we could solve that problem, we wouldn't have as many healthcare issues in general. So I think that the biggest thing that I would recommend is do the thing that you're gonna do, right? If you hate going to ride the bike at the gym, don't do that. Do something that you're gonna enjoy, right? So maybe go for a hike. But if you like to play soccer or baseball, go and do those things. But make it so that it's enjoyable, so it's sustainable. Because let me tell you, when you're young, it's a lot easier to build a habit than when you're in grad school and when you're married with children, speaking from experience, working full time. So find a way to develop a habit with something that you enjoy doing that elevates your heart rate for 30 minutes or so. And so there's a myriad of ways that you can do that. Some people like to go to the gym. Some people like to go ride the bike outside. I would say usually what I do when I'm negotiating with patients, or not negotiating necessarily, but kind of talking about that, I'll ask them, what do you like to do? What are the things that you enjoy? And I'll cater it to make it so that it's feasible. They're gonna be more likely to do it because they enjoy it.
Thank you. So, Dr. Lin, what are some of the first aid measures that people can take at home in case of sports injuries?
I think there's a few acronyms for that, including PRICE or PEACE, but I think they all involve P being protect. So you have to protect the injured joint. Rest is, I think, the R. Elevate, compress it. Cold packs can be helpful, although there's some controversy over you don't want to overdo the cold either, because you don't want the skin just frozen all the time. That's not ideal either. There's also some recent studies showing that if you do too much Aleve or ibuprofen, so you also don't want to do too much NSAIDs or anti-inflammatories, meaning like around the clock every day for an injury, because that might actually affect your body's own natural healing response. Although it's fine to take those occasionally and take them as needed. We've kind of shifted away from telling people to take these things around the clock for like an acute ankle sprain. But obviously, if it's something that looks severe, has any weakness, numbness, anything where you're worried about a cut or a fracture that needs more attention, like a laceration, then going to an urgent care, or if it's very serious, going to emergency room is very appropriate.
Thanks, Dr. Lin. And Dr. Dith, can you talk a little bit about physical therapy as a profession, and what should people expect in terms of the training journey?
Sure. If someone wants to go into physical therapy, they really should like science, medicine, enjoying anatomy, physiology, physics, kinesiology. It's part of the training. I think that enjoying being around people, giving them instructions about exercise, understanding the benefits of exercise, volunteering at a local hospital or outpatient clinic, and trying different settings and seeing if it is for them. They have to take or have a bachelor's degree, and then it's a doctorate program after that to be a physical therapist.
Thank you for giving us the overview of the journey to physical therapy, Dr. Dith. So, Dr. Simpson, can you please talk a little bit about job opportunities for people who may be interested in physical therapy as a profession?
Yeah, so one of the roles that we have for folks who are interested in PT, I'll frequently have people who are just volunteering, and they just wanted some exposure to it. So you just email or show up at your local PT clinic, or like where your parents went for PT, and just say, hey, I'd like an opportunity to just kind of like watch and see if that's something that I'm interested in. And then a position that we typically hire for regularly is called an exercise tech or a physical therapy aide. And essentially you get exposure to it. You can help with scheduling and phone calls, cleaning tables, and then when it's appropriate, walking patients through exercises that are prescribed by the PT. And so that's a pretty nice way to get exposure to the field in outpatients. They have inpatient positions as well. but kind of like Dr. Dith mentioned, I think just going out and exposing yourself to it, either volunteering or observing, goes a long way. Because as you mentioned, it's rather rigorous, so you better make sure that you enjoy it.
Thanks, Dr. Simpson. The next question is for Dr. Lin. So, Dr. Lin, we see very few women choosing orthopedics as a specialty. So, why is that? And what would you say is the most fascinating part about being an ortho?
Yeah, so I'm a sports medicine physician. So orthopedics would be the surgical side. And certainly there are some sports medicine physicians who are sports medicine orthopedics as well. I mean, I think the disparity in terms of specialty choice has a lot to do with surgical versus non-surgical specialties. I mean, I think there's good data showing that, there's still a lot of barriers to getting underrepresented minorities as well as women in specialties that are very, very demanding in terms of training. I mean, medical training is demanding in general, but then obviously surgical training even more so, right, in terms of time intensive and just everything, right, that might make it harder to juggle family commitments. But it is improving, and I would say that don't let that discourage you. I mean, obviously, I work with a lot of female surgeons across the university and other universities that I've worked with. And as they've progressed in their career, they've been able to have more flexible work arrangements that actually make it possible.
Thanks for that, Dr. Lin. So, Dr. Dith, what inspired you to go into physical therapy? Were there any specific experiences that inspired you to go into this field?
Well, I actually worked for a podiatrist in my teenage years, and he had mentioned physical therapy way back then. He mentioned that it was an up and coming field and that I should research it. And through the research, what I really liked about it was that you can see a diverse number of patients of different ailments, and you can also work in different settings. So outpatient, inpatient, home health, and then, the varieties you can see from pediatrics to neurologic, geriatrics, orthopedics and all. So I like the challenges of being able to see a wide variety of patients. And I choose to be in outpatient. A lot of it is just seeing the quick response through exercise and manual therapy, and enjoy seeing people return to their functions of either going back to work or going back to playing sports or any recreational activity.
So, Dr. Dith, as a follow-up to that, I know you also mentor a lot of young people. How important is that in your practice?
Yeah, we love to teach them, and it's very rewarding to see them grow, learn, and then move on to applying for PT school and come back and say hi and have a career and call them our colleagues.
That's great. Dr. Simpson, can you share a success story of a patient that really left a lasting impression?
Yeah, it's one of the fun parts about PT is that you continuously help with the progress. So I mean, you see it every day. So I don't know if there's one in particular. Let's see. any type of athlete that you're working with. So like going from someone who had an ACL reconstruction, okay, I'll give you one. I had a patient who came and had an ACL reconstruction and a meniscus repair. And they, right out of surgery, so I know this person, and she went to a different clinic and had a bad experience because there wasn't a lot of like empathy per se. That there wasn't the patient wasn't getting a lot of attention from therapists. They saw a few different providers, and so her range of motion was really limited when she came in, and that can happen sometimes after that surgery. But like so a typical knee range of motion is from like totally straight with your knee to about 140 degrees when after ACL reconstruction, maybe a little more than that. And she was about, I don't know, 15 degrees to like 70. She was pretty tight, and it's hard to move that way, to go up and down stairs, to walk. And so just yesterday, she got full motion. She's doing agility drills in the agility ladder. We're able to start working into running now. And so being able to watch the progress from where somebody you can barely walk to where you're legitimately running over the course of like a 12-week span of time is pretty awesome. And there are stories like that all over the place. So yeah, it's, as a profession and generally, it's very rewarding in that sense, because you get to walk them through how to do it, and then see them literally run out the door. So it's pretty fun.
Thanks, Dr. Simpson. So, Dr. Lin, what are some skills that you think people should develop and work on if they hope to go into physical therapy in the future?
Is that one for me? Great. So, I can speak about, at least for sports medicine and medicine in general. Obviously, I think a lot of the training for whether it's physical therapy or sports medicine is very science-based. But after that, I think it's like people skills every day, right? That's like so overwhelming more important on a daily basis. So it's like you have to have all those skills to even get to these kinds of healthcare professions, is to be able to do the science and study and understand these concepts. But at the end of the day, it's a people job, right? So all day long, we're seeing people, and they're from all sorts of different backgrounds. They might have completely different belief systems than we do. They might believe that every time they walk up the stairs, it's like breaking their knees, right? And so it's like you have to like really be able to understand people who have like vastly different belief systems, and sort of figure out they're coming to you for a reason, right? They took time out of their day, and just try to figure out their story and why they're there, and how can you actually connect with this person, at their level of understanding of what's going on in their lives. And so I think like those soft skills are just critical.
Thanks, Dr. Lin. I think now we'll go to questions from the audience that we have. So, Louise, you can go ahead with that.
Okay, so one question I got was from Dr. Dith. How important is strength training as a part of a regular exercise program? And we're like, what are the most important aspects of this?
Strength training is very important, not only to maintain what you have, but to improve upon that, so that you are well prepared for whatever activity you need. There's strengthening and conditioning. You want to build up the strength, but you also want to condition the muscles so that they don't fatigue, so that you can do those activities without endangering the tissues.
Another question I received was for Dr. Lin. Are growing pains a real thing? And like, how do people experience these growing pains?
So during the years of rapid growth in early adolescence, growing pains have been described, and some people might experience like leg pain or joint pain at night. But I think it's important because there's other types of pain, so that, it's important that they seek advice from their pediatrician to figure out what it is, right? Because there's other causes of pain. We also see different specific types of injuries in adolescent and teenage athletes that might be related to like overuse or jumping sports that can also cause knee or ankle pain.
I'll now pass it to Bryan for the audience questions.
Thank you so much. I really appreciate it. So the audience question I have is, do you observe a correlation between mental / emotional components in the improvement of patients during physical therapy?
You want me to answer that?
Sure.
Well, the short answer is yes. There's a pretty strong correlation, and we're just kind of learning about it a little bit more so now. So pain it's all that information is processed in your brain, right? So you have like a nerve signal that comes. So like, let's say, you take a tack and you put the sharp end into your finger and it hurts, right? So what happens is the signal goes from your nerve to your spinal cord. That signal goes to your brain, and then your brain receives that information, and the sharp information is perceived as, ouch, that really hurts, right? And so what happens if somebody's also experiencing, depression, or they've got no support system, your parents just died, or you're really stressed out, those pain signals tend to be elevated, or like they're interpreted at a higher rate, which isn't to say that the person's crazy or anything like that. It's all in their head. It's just pain is different for everybody, and it tends to be higher for those who are in a particular scenario that involves depression and anxiety. So kind of like what Dr. Lin mentioned, we're all people, right? And you got to kind of start with that. So if you can figure out a way to communicate to that person to help them understand their pain a little bit better, I find that goes a really long way. And also appreciate that there's other things happening that are going on that are definitely going to affect the way that they're perceiving their pain. So yes, that's the long answer. It does play a role for sure.
And also, if people are motivated in doing their exercises, they will have a better outcome. Being an active participant in exercise versus just having passive manual therapy plays a big role with that mental state.
Thank you so much. I really appreciate it. I'm going to pass it now to Antonio for the next audience question.
Thanks, Bryan. And this question goes out to any of the panelists that want to answer it. But folks were asking, have any of you worked with patients using prosthesis and or bioengineering research?
Yes, I've worked with amputees before. It's amazing the technology that they have, where they have computer chips that allow the movements to be more smooth. Yeah, but it's not a routine. I don't see many amputees though, but I'm sure the technology has advanced over the years since I last saw an amputee.
Thank you so much, Dr. Dith. That's all the time we have questions for now, unfortunately. But thank you so much, Dr. Lin, Dr. Dith, and Dr. Simpson. We're so grateful for your time today.
Thank you, Mara, for having us on.
Thank you.